Hello everyone, today we're going to be learning about irritable bowel syndrome, which is the next in the gastroenterology series. So by definition, irritable bowel syndrome is a gastrointestinal disorder. It's typically caused by disorders in intestinal mobility or absorption, disorders in the movement between the gut-brain axis, and it's very prevalent. So it's a very prevalent disease. The prevalence is roughly between 10 to 20%, which is about a fifth, which is quite common. The typical age of onset is less than 40 years old, so it most typically presents in the 20 to 40 age group. It's worsened by things like stress, menstruation, and gastroenteritis. Now, to qualify to be diagnosed for irritable bowel syndrome, we want to have two of the following symptoms for at least 6 months. And these symptoms include abdominal pain that is relieved by defecation, which means going to the toilet, and altered bowel frequency. So that can be either diarrhea, constipation, or a mixture of both that alternates. And altered stool forms. The stool may be excessively bulky, dry, hard, wet, which tends to fluctuate. Other signs can include increased urgency, so needing to go to the toilet more frequently, incomplete evacuation or tenesmus, which is the feeling of still needing to go to the toilet despite emptying, excessive bloating, and flatulence. Irritable bowel syndrome can be investigated through taking a full blood count. Especially, we want to be looking for raised inflammatory markers such as the increased ESR or increased CRP. A very common differential will be celiac disease due to having very common and similar presentations such as the bloating and the poor absorption. So we want to rule out celiac disease through taking a celiac serology to test for tissue transaminase antibodies. Furthermore, other differentials can include IBD, so especially Crohn's disease, and we also want to always rule out things like bowel cancer, especially if the patient is presenting with other markers such as blood and stool, or weight loss, anemia, or if they're of age, so they're over the age of 60, we want to take a colonoscopy to rule out ovarian and bowel cancer. To manage irritable bowel syndrome, firstly, we'd try to manage it conservatively through asking the patient to go on a high fiber diet of high in fruits and vegetables and to increase their fluid intake and exercise, as this would help to ease the passage of any food and gastrointestinal products through the GI tract and system. We want to avoid any foods that would exacerbate diarrhea or bloating. For example, sorbitol sweeteners, alcohol, and caffeine can exacerbate diarrhea, so we want to avoid those. And lactulose can also aggravate bloating, so you want to avoid lactulose. Some of the medical ways to treat the above symptoms would be as antispasmatics for bloating. We can give antidiarrheals such as loperamide to ease diarrhea, and any patients with constipation, we can give laxatives. If laxatives are not working, second-line treatment for constipation would be things like glucaraplide, linaclotide, and lubiprostone, or self-administered anal irrigation. And finally, irritable bowel syndrome, we cannot underestimate the psychological impacts that having such a disease can have. So we can also provide CBT and low-dose tricyclic antidepressants such as amitriptyline or hypnosis for any psychological symptoms from the disease, as it can potentially lead to complications such as mood disorders and a poor quality of life. So we want to, in whatever way, help these patients to manage and to treat irritable bowel syndrome. Thank you for listening.